Cognitive therapy is a system of psychotherapy. It consists of a theory and an organized body of principles for applying this theory to the treatment of patients. There are various principles involved in the theory. The major principle is that the way an individual perceives his reality will influence the way he behaves and the way he feels and the way he approaches his problems. Consequently, if he misperceives reality, then he's going to have aberrant feelings, he's going to behave in a maladaptive way, and he's going to have difficulty in solving his problems. Underneath this type of misperception, we often find there are many distorted beliefs. In depression, the beliefs center around a negative bias towards the self. The depressed person perceives himself in a negative way. He sees himself as a loser. As he looks back on his past, he thinks of himself as a failure. The present is filled with predicaments, and the future with futility. In contrast, the anxious patient may not see himself in a negative way, but he sees himself as surrounded by dangers, and he believes that he is not able to cope adequately with these dangers. The paranoid patient, in contrast, sees himself as the victim of abuse, persecution, intrusion, blockage, frustration, and the like. All of these disorders have a particular type of thinking disorder. First, there is selective abstraction. The individual fastens his attention on a few significant details in a particular situation, but he ignores all of the other details. The depressed patient, for instance, may only perceive those incidents in which he fails or does not live up to his standards, and he misses all of the very positive aspects of a situation. Second, the individual may jump to sweeping conclusions on the basis of minimal or inadequate information or data. Third, the individual tends to overgeneralize. Thus, if he makes a mistake in one situation, he may believe that he makes mistakes in every situation. Finally, patients in these disorders tend to show all or nothing thinking. For instance, if a depressed patient is not totally successful, he is likely to see himself as a total failure. Now, how do we apply these theoretical principles to the actual therapy situation? Actually, the theory is a kind of a blueprint which we use in order to organize the information that we obtain from the patient. This blueprint helps us to understand the patient better, and it also enables us to select those tactics and strategies that will enable us to treat the patient. The main objective in the therapy is to try to adjust the patient's biased thinking in such a way that it conforms in a more regular and accurate way to the actual external reality. Now, there are many techniques that we use in cognitive therapy. First and foremost, it is important to establish a good working relationship with the patient. This is something that we call collaborative empiricism. The patient and the therapist work hand in glove, testing out the patient's beliefs, evaluating them, seeing whether they're accurate or not, and modifying them according to the requirements of reality. Secondly, the therapist uses questioning in order to unravel the mystery of the patient's problems. This is something that we call guided discovery. The patient and the therapist try to work to ascertain just what the distorted thinking is, and then they attempt to evaluate the distorted thinking. There are many ways in which one can evaluate conclusions that a patient makes which do not seem to conform to reality. First, one can ask What is the evidence for your conclusion? Are you leaving anything out? Are you omitting contradictory evidence? Does your conclusion follow logically from the observations that you have made? And finally, are there alternative explanations that may be more accurate in explaining a particular episode? The ultimate goal, of course, is to correct the patient's misconceptions. Once they are corrected, the depressed patient becomes less depressed, the anxious patient becomes less anxious, and the paranoid patient becomes less paranoid.